It's my feel-good breakfast show.
Hey, it's a Tuesday morning. Welcome back to your Feel Good Breakfast Show. It is so good to be in your company. Thanks for joining us at the start of a brand new day. Now, of course, keeping your heart healthy and strong is particularly important, especially during a pandemic such as COVID-19. Now, suffering from a heart disease and even hypertension puts you at a greater risk for a more severe form of the coronavirus. But there are a few things that can be done to protect your heart during these uncertain times. And our trusted medical advisor, Dr. Darren Green, joins us via video call to tell us a bit more. And if you have any questions, please do give us a call. That number is 021-110-5552. Signore, Dr. Green, how are you this morning?
Fantastic. And you, tenore.
Absolutely fantastic. Good to see you. Let's talk about heart disease and how much of a problem is cardiac disease during this time?
It's an incredible load and burden to the health system, particularly in South Africa as well. I mean, we've got close to 20 million, deaths associated with cardiac disease worldwide. But if you think about it annually, in South Africa, our amount of heart attacks per hour are normally between about 5 and 7 heart attacks per hour, and then up to 10 strokes per hour in this country. So if you think about that, it's an astounding figure that affects obviously the longevity and life expectancy of many South Africans. And it's a preventable disease to a large extent if people just know about the early warning signs and prevention strategies.
Yeah, and those are certainly extraordinary numbers that stick with you. So let's get to understanding then. How do I know if everything is okay with regard to my heart's health, and what should I be looking out for?
Yeah, great question. So I think one of the big ones are the heart, obviously, in its primary function in providing pump function and supplying oxygen via the blood and hemoglobin to all the different body systems. You can imagine that if oxygen is not delivered to the tissue, the systems can't perform. So often you're confronted with the first few signs, which are fatigue, shortness of breath, obviously looking at things like cold peripheries, because the pump function is not getting the warm blood to the fingertips, the legs, the toes, etc. Along with that, obviously, comes then a myriad of other issues associated with low oxygen to the brain, the kidneys, etc. So you can present in many different ways, but often shortness of breath, chest pain, fatigue, swelling of the legs, all those symptoms can be indicative of underlying heart disease.
I'm sure that you at home, as you're listening to this conversation, might have your own questions to ask. So do give us a call on 021-110-5552. Dr. Green, we've spoken about the fact that a lot of this is preventable by making certain lifestyle choices. But have there been any new exciting breakthroughs in regards to prevention?
Yeah, I think quite interesting to note is that the influence of activity, physical activity, on heart health has definitely shown to be a massive contributing factor in preserving heart function. But so too the combination of choices around things like smoking. 25 to 30% is the amount of your chances being higher of developing coronary vessel disease if you're a smoker. That's a third, 30% more. So obviously that's quite crucial. And then, of course, we're also looking at the association of stress and dealing with your and how that's interlinked with your biology as well. So the type of choices you make in coping on a day-to-day basis have a direct bearing on the heart. The heart's a sensitive organ.
Mm-hmm. Now, when we focus on chest pains more particularly, when do you need to start worrying about a chest pain that you're experiencing as being severe and serious enough for you to go and see a medical practitioner?
Yeah, that's a great question. I think a lot of people start getting chest pain when they put the heart under stress or under more pressure. And that means the heart muscle itself needs more oxygen to carry out its function. And at that time, often you expose the chest pain. So with exercise, if you develop any form of excessive shortness of breath or chest pain, excessive dizziness, for example, that's when you should definitely have yourself checked out. And then, of course, chest pain that feels like an elephant sitting on your chest. They speak about an elephant crushing the chest, basically feeding that as with associated symptoms of nausea, sweating, what we call diaphoresis. Those are important signs to consider. And then also people complain about the abnormal rhythms of the heart as well, where the heart rate is all over the show, and they heightened awareness and palpitations with that onset of pain and not feeling well. Don't leave it and assume it's just going to pass. Have it checked out, and then ask for your family history as well, because that's very important.
Yeah, absolutely. Well, Dr. Darren Green, it's always fantastic to chat to you, but don't go too far away. And you at home, stay tuned to your Feel Good Breakfast show, as Dr. Darren Green will be answering viewer questions on matters of the heart and COVID-19. That number to dial 021 110 552. But of course, before we get to that, our fitness expert, Raul Demorne, will be showing us a few exercises to strengthen and to protect our hearts.
It's my Feel Good Breakfast Show.
All right, as the rain continues to pour down over the mother city, creating a crescendo
Yeah, ooh, that
of
works.
a sound around us. It sounds like there's a crowd just like cheering us on.
Is that what crescendo means?
A crescendo meaning an increase of volume.
Oh, wow.
sound.
I learned something new every
Yeah.
day.
Well, we are learning a whole lot more from, of course, Dr. Darren Green, because we continue our health topic this morning, and our trusted medical advisor, Dr. Darren Green, is still with us and will be answering all of your burning questions with regards to your heart health and COVID-19. Thank you very much for sticking around with us, Dr. Green, and we're going to have a look at some of these questions that have come through on social media that you're going to be answering for us. The first one from Kogi Naidu, who says, "Good morning, Expresso team. I'd like to know, is it possible for a person's blood pressure to be high, example 140, and for the heart rate to be low, maybe 40 or 50? I want to just take, even just a step back from that, and let's quickly discuss those numbers and the measurement of what a 140 in terms of blood pressure means, and what a 40 or 50 in terms of heart rate means, and then bring those together."
100%. So normal blood pressure, we often refer to 120/80 in males. In females, it can be a little bit and should be a little bit lower than that, about 110/70. The top value is the systolic blood pressure. That's the pressure in the system while the heart is actually contracting. So that's why it's a higher value. Pressure's higher when the closed pipe system is actually under pressure. And then the bottom value, the 80, would refer to the diastolic blood pressure, when the heart relaxes, what the pressure is in the system. So that value of 140, I assume that the listener is referring to the top value, the systolic blood pressure, which is just slightly over, obviously, normal. We want to get it under 120, ideally. So yes, a normal blood pressure, as you know, as I've explained. The pulse, however, what's the normal pulse rate? Well, pulse rate is considered normal from 50 and up. If you are fit, extremely fit, like you, Kat, then your morning pulse rate can be actually under 50. Our mountain climbers that do Everest, that are triathletes and marathon runners, often have morning pulses as low as 40. Some people have even dived under 40 when they wake up in the morning. That's how conditioned that heart muscle is. In other words, it needs to beat a lot less frequently to pump the same amount of blood and oxygenation capabilities to the rest of the body. So that pump is so well conditioned, that muscle is absolutely honed and in great shape. That's why they need less. So can you have blood pressure that's elevated and a low pulse between 40 and 50? Yes, you certainly can. Fit athlete, for example, can also have a low pulse rate, as they've depicted there, but have family hypertension. Doesn't mean that if you're fit, you're not open to developing hypertension or high blood pressure. So keep an eye on that blood pressure and definitely monitor it regularly, and seek help from your doctor if you need to.
Yeah, and so important it is to get those annual checkups done, to know your numbers, to know
Absolutely.
where you stand, especially during this time. And when we ask the question, and maybe you could just highlight it for us once again, Dr. Green, about why it is so important to protect your heart health during this COVID-19 pandemic, and how indeed you can do this.
Yes, so the big thing here is that we have found that the people that are dying from COVID-19 are people with comorbid disease, people that have the following in order of importance: hypertension, so uncontrolled blood pressure, leads to heart disease, but also in the COVID or this pandemic setting, it lays you vulnerable to having early death and your ability to cope under the infective parameters. The second component, obviously, is diabetes that you know about. And then, of course, coronary vessel disease or cardiovascular disease. And why that's important is COVID can affect the work of the heart in many ways. With the lungs being sick, your heart has to work harder in oxygenating the rest of the body. So it puts the heart under strain. That's why COVID infection actually sometimes exposes, obviously, the heart. Then myocarditis, which is inflammation of the heart muscle itself. Obviously, we're looking at the effect of what they call the ACE2 receptors and its expression in the heart muscle, and how that then relates to weakening the heart and can cause permanent damage to the heart, by the way. Like training with influenza virus does, so too you can develop scar tissue in that muscle and weaken the function of the heart down the line. And then obviously one must also consider in COVID, you have the conditions associated in the arteries and the veins of what we call thromboembolism, where you can have the blood viscosity, the thickness changing, clots forming, that kind of thing, which could also then block the pipes and lead to poor blood supply to different body organs and cause dire effects. So that's why it's important to look after the heart. And that's why we need to obviously look at primary and secondary prevention. And that would mean things like regular physical activity, not smoking, for example, meticulous control of your blood pressure, and then, of course, eating healthily and looking at the inflammation that comes from eating certain.
Well, thank you to Dr. Darren Green, for sharing your knowledge on the matters of the heart and COVID-19 with us this morning. It's always so great to have you on the show with your expert advice on all the important health matters that affect so many of us. And of course, we were even saying that you know everything about the heart. You would even tell us how to mend a broken heart. But thank you so much, Dr. Darren Green, for your time this morning.
Thank you. Thanks, guys. And keep up the good work. Thanks for helping educate South Africa. Thank you.
Thank you very much to Dr. Darren Green, and to you out there, keep your heart healthy.